Hello, my name is Adam Riedel. This is my BSN246 focused respiratory examination video on Kyle Reeves. So I'm going to begin by going in the room, closing the door, giving him some privacy, washing my hands or using some hand sanitizer, and introducing myself to the patient. So, hey Kyle, my name is Adam, and I am going to take over for the last nurse that was here, and I'm going to do a little bit of a focused respiratory examination on you. But can you tell me your full name and your age?
Yeah, Kyle Reeves, 16.
Okay, and Kyle, what's bringing you in today?
I haven't been feeling good for the last 4 days.
Mm-hmm.
Just really tired, fatigued, short of breath.
Okay, I can tell you're kind of short of breath just by talking there, so yeah. And have you had a productive cough at all? Has anything come up with your cough, or is it dry?
I've been coughing up yellow.
Coughing up yellow, okay.
Yeah.
When you cough up that yellow stuff, does it hurt at all?
A little bit,
A little bit of pain. And does anything at home help ease that pain?
Yeah, if I take a hot shower, usually I can kind of clear up my chest congestion.
Well, that's a good idea. Okay, and so when you're not doing that and you're coughing, when it's hurting, if you could give that a number, what number would you give it?
Probably a 6.
A 6. Okay, so that's not like the best at all. Okay. How's your appetite been? Have you been eating well?
Yeah, I've been eating more warm fluids for the most part, and soups.
Okay, losing any weight or gaining any weight?
No, my weight's been stable.
The weight's been stable, that's good. Okay, so I'm going to just do a couple of vital signs on you, and then I'm going to kind of just like look at you and listen to you, and then I'm going to end by just using the stethoscope and just listen to your lungs. Okay? So, we'll start by getting your blood pressure on this arm that you're giving me already. Makes things easy. And Kyle, do you take your medications pretty well at home?
Not really.
Not really?
There's a lot of them.
Yeah, I bet. You've had cystic fibrosis for a while, so I'm sure that you've got quite the list. Goodness. Okay. So, blood pressure's good. That's normal. 118/78, which is well within normal range for you. I'm going to get your temperature now. You said you've had a temp for a while, huh?
Mm-hmm.
It's like 4 days or something like that. And we'll just keep that consistent, 101.9. So, yeah, decent temperature. So let's go ahead and get your pulse ox, which is this little thing that's going to go on your finger. So beep. And then I'm just going to get your pulse while we're getting that at the same time here, okay? All right, so I got your heart rate at about 90, which is good. Teeny bit elevated, but nothing to be alarmed about at all. And then I just had my hand on you here when I was looking at your respiratory rate, which was a little bit higher than normal. We got you at 30, so you can kind of tell that you're working to get good breaths. But when I had my hand there, I was just kind of checking the symmetry of how your breathing was when you were breathing in, breathing out, inspiration and exhalation. And that seemed to be symmetrical, as well as when you're breathing in and out the front and the back, or the anterior and posterior portions of your chest, which is good. And then that thing on your finger is reading at 89. Not the greatest, but with your cystic fibrosis and everything that you're having, kind of to be expected. So some supplemental oxygen is probably going to be one of our good interventions that'll help with that. So let's go ahead and auscultate your lungs. So just kind of breathe deep when you can, but just, normal breaths for the most part. I don't want you passing out with all of this. So Big deep one. Be a big deep one in here. Mm-hmm. All right, let's go to the back. So get ready your blanket. I know you were a little cold, even though you're febrile. Give me a big deep one. All right. 2 more. 1 more. All right, Kyle. So good job. I am noticing that your breath's a bit on the diminished side, and you got wheezes on both sides, or bilateral wheezes. I didn't really hear any crackling or anything like that, that's good. That indicates that there isn't really any edema, which is always something that we want to watch out for you. Do you have any questions or anything right now that you can that I can answer for you?
No.
Okay, so I would put the patient back in a comfortable position, document the assessment, and close the door, wash my hands, and carry on. Thank you.